Right, good morning everybody again. Mr. Gill.
Thank you, my Lord. Good morning.
Good morning.
My Lord, the witnesses this morning are Dr. Marsha Clark. Sorry, no, first mistake. Marsha Scott.
Yeah.
And Miss Catherine Murphy. They are speaking jointly to a statement that Dr. Scott has prepared. The reference is SCIWT 0578 and 50 is 1. And they are giving evidence on behalf of a group of 5 organisations. They are called, as a group, they're called the Scottish Women's Rights Organisations.
Yeah. Very good, thank you. Now, Dr. Scott, Miss Murphy, right, who's who? Miss Murphy, Dr. Scott, please make yourselves as comfortable as those chairs will permit. Yes, when you're ready, Mr. Gill.
Thank you, my Lord. Can I begin, Dr. Scott, with you? Your full name, please.
Marsha Scott.
Yeah. Can you tell us how old you are? You don't have to tell us your date of birth, but just your age.
Well, I'm not sure what the difference would be, but I'm 70. Thank you.
Thank you. And the inquiry is aware of an address at which to contact you.
Mm-hmm.
And your position, as I understand it, is that you are the Chief Executive Officer of Scottish Women's Aid.
Yes.
And that is one of 5 organisations that you are representing here today.
Yes.
And those other organisations are Close the Gap, Engender, Just Right Scotland, Rape Crisis Scotland, and the organisation you're CEO of, Scottish Women's Aid. Miss Murphy, could you give us your full name as well, please?
Catherine Murphy.
Yes. And your age again, please?
44.
Yes. And again, the inquiry has an address at which contact can be made with you. Can you indicate your role within these organisations?
Yes, I'm the Executive Director of Engender.
Yes, thank you. We'll come to discuss in some detail the roles of the various organisations. But just to begin with, I wonder if I can be permitted just to make a few observations, really for your information and indeed for my Lord's information. We have already had certain information before the inquiry, particularly yesterday from a witness from the Alliance. And I think Engender is a partner organisation with Alliance. And so there was some evidence of the impact of the pandemic on women, but very general, and we are looking for you to provide more detailed evidence of that. In your statement, which is under the name of Dr. Scott, you do refer to the black and ethnic minority women's community. And I think it's right that I do indicate to you that the inquiry has been contacted through Let's Be Heard by an organization called Amina. I think you're aware of that. It represents black and ethnic minority women, and we will be obtaining further information from that organization and probably a statement from that organization. So I would like you to know that before we go any further. In addition, as I think I've already told both of you, the inquiry is obtaining academic research in relation to the impact of the pandemic on women and girls, and that research is under preparation at the moment. I can't give you a date as yet as to when it is going to be produced, but obviously when it is produced, we would like to have your comments on it. Also, and I think probably finally, you've provided us, accompanying your statement, with a number of documents. And we are very grateful to you for those documents because they assist the inquiry considerably in its work and its research. And the material that you've provided us with will be taken into account fully, beyond anything that you might wish to say about it, but it will be taken into account, analysed, and will be input into our final work on the subject. So with those preliminary remarks, can we turn to your statement? And Dr. Scott, can I ask you, really, as the writer of the statement and the person in whose name the statement is given, could you go to paragraph 3, because I think we've dealt with the introductory material in 1 and 2. Paragraph 3, you indicate what this statement is addressing, and I think in paragraph 4, you caveat that by saying that this is necessarily a brief statement. Has that presented any particular problems to you in producing the statement?
I think the problem is the brevity, and we're looking forward to having making individual statements that will allow us. So for instance, under my organization, to give some much further detail and nuance about the impact of the pandemic on the women and children that we serve, as will the sister organizations in it. I think our biggest anxiety, well, I don't want to speak for Kat, my biggest anxiety today was not doing justice to the breadth of the issues. We will do our very best to do that. And having said that, Deirdre, could somebody go get my papers that you brought me? I managed to leave them in the kerfuffle about my laptop. Thank you. I suddenly realized this was way too clean. So we're going to do our very best to do justice to everybody, but there will be, I know, opportunities for us to do individual statements, and we'll nuance.
Well, I think the inquiry recognises that this is introductory, so far as the inquiry is concerned, and that it is not possible to go into the depth of information that you obviously can give us at this initial stage. But as you've anticipated, it is, I think, without committing, I think it is almost certain that you will be back here at some point in time.
Can I just add a little something to that, which is that we were delighted to see the input to the UK COVID inquiry from Claire Wenham about the impact on women and girls, and lots of discussion there about structural inequality and the same kinds of things that we would be talking about across the piece. So I kind of felt that there was another good reference, available, or resource available for you.
Well, that's very helpful because, of course, we are liaising with the UKI, and we will be taking into account material that is germane to both us in Scotland and UK-wide, and we will be looking at that.
Perhaps I could interject to say a little bit further, and that is that in a matter like this, it's perfectly possible that your ideas, thoughts might develop over time. You should be under no fear that anything you say today is cast in stone, because if your ideas and thoughts develop over at least the course of this inquiry, as I'm sure Mr. Gill would agree with, you should feel entirely free to come back and tell us, and indeed ask to give evidence again if you want to develop or amend your thinking.
Thank you.
Thank you, my lord. Yes, I'm in entire agreement with that, and I would be saying to you at the end of your statement and your evidence today that if there is any matter that you suddenly realise you hadn't mentioned, you should have mentioned, would like to have mentioned, whether that's tomorrow or 2 months hence, please get in touch with the inquiry and tell us about it. Can we go to paragraph 7, please, of your statement? Can you tell us there about the 5 separate organisations? They are all, as you say, charitable organisations, and they work to protect the rights of women, children and young people and marginalised groups in society and promote gender equality. And then you tell us about each group. So can I trouble you to read from paragraph 8 onwards so that we can have that available to us?
Sure. Before I do that, can I just mention that part of the reason that we hope the inquiry will find what we say powerful is that all of us are national strategic intermediaries, which means that the Scottish Government has recognized our role. So, for instance, we're an umbrella organization, which I'll talk about, but we cover the entire geographic area of Scotland, as does Rape Crisis Scotland and Engender and Just Right Scotland, and Close the Gap. So while we're sitting here in the Central Belt, it's critical that everybody understand that the data that comes into us and our experience is very much colored by that.
Thank you very much. That's very helpful. Yes.
Close the Gap is Scotland's expert policy advocacy organization working on women's labour market participation. For over 20 years, Close the Gap has been working with policymakers, unions, employers, and employees to influence and enable action to address the causes of women's inequality at work and to tackle the gender pay gap.
I think, Ms. Murphy, you're in gender, so perhaps you can just tell us about your organisation.
Let me firstly say that we are also submitting evidence through the Let's Be Heard process. Yes. And just in the question about the brevity of this statement, one of the things that we want to stress is that we will mention the intersectional dimensions of people's experiences. So we are focused on gender equality, but people have different experience based on their race and ethnicity, their disability, etc. And we've tried to do justice to that in this statement, but I'm really pleased to hear that you're inviting Amina too, because we would really encourage you to engage with other groups of women to focus in on their specific and particular experiences. So,
can I just pause there? Yesterday, we had an indication from Sarah Redman of the Alliance on the proper understanding of intersectional. Yeah. And I think it's very important that we have that, so thank you very much for that.
We have that focus, but speaking to specific groups gives you a much greater depth of information. So Engender is Scotland's feminist policy and advocacy organisation working to realise a Scotland where women have political, economic and social equality with men and equal access to resources, rights, safety and decision-making on the same basis. Engender engages Scottish, UK and international policymakers to ensure that systemic inequality between women and men is visible and understood in policy-making processes and addressed via equitable, gendered decision-making and resource allocation.
Can I put this possibly to both of you? Because this is something that comes up later in your statement, and it may be useful just to understand it at this point. Later in your statement, you refer to gender competence. Can you explain what that is, please?
I'm happy to do that. I've written a chapter about it, as a matter of fact, which I'm happy to send the inquiry. Gender competence is essentially the embedding the understanding that men's and women's and girls' and boys' lives are different, and that the policy that you make and the services that you design and the resources that you allocate are not gender competent if they don't reflect that reality. And it seems like it's very simple, but in fact, you know, our societies are the result of, you know, hundreds of years of gender incompetence, so to speak. And the reality for us is that, and this is a really good opportunity for me to talk about the structural inequality that drives the disproportionate harm that we saw under COVID for women and children, that if in fact the decision-making during COVID and prior to COVID had been gender competent by officials, and I think it's really important that, at least from our perspective, we're not just talking about the Scottish government, but we're talking about the court service, we're talking about the police, we're talking about all of Scotland's public institutions. If they had been gender competent, we would have seen a very different picture during COVID. And so, you know, in Scotland, the Scottish government is committed to responding to the National Advisory Council on Women and Girls requests to embed gender mainstreaming and to support the implementation of training such that gender competence is a feature of the policymaking and the parliamentary work that we do in Scotland. We are far from there, however.
Right. Obviously, you're going to give us examples and explanations of where there has been a failure of gender competence in the way in which the pandemic was dealt with as regards the interests of women and girls. Maybe seem a rather mundane question, but do you consider, as a contrary position, that there was gender incompetence?
Absolutely.
Okay. Can we go on to paragraph 10, please? Just Right Scotland. Whoever wants to deal with that?
Yeah, Just Right Scotland was established by an experienced group of human rights lawyers. It uses the law to defend and extend people's rights, working collaboratively with non-lawyers across Scotland towards the shared aims of increasing access to justice and reducing inequality. Just Right Scotland provides direct legal advice to people who would otherwise struggle to access justice, and it operates the Scottish Women's Rights Centre in collaboration with Rape Crisis Scotland and the University of Strathclyde Law Clinic. It provides free legal information, advice and representation to women affected by abuse and violence in Scotland. Informed by its direct work with victim survivors of gender-based violence, Just Right Scotland seeks to influence national policy, research and training to improve processes and systems and improve the outcomes for women who have experienced gender-based violence.
Thank you. Rape Crisis Scotland, I think, probably is an organisation we've heard quite a lot about, so perhaps you could just tell us about that?
Sure. Rape Crisis Scotland is the leading organisation in Scotland working to end sexual violence by influencing justice reform and gender inequality, delivering prevention work to young people in schools and higher education settings, and running a helpline. Rape Crisis Scotland works to raise awareness of the prevalence and impact of rape, sexual assault, and abuse, advocates for better health, justice, and community responses, and works to make sure that survivors can access specialist support. It has 17 member centres that provide life-saving support and advocacy services to survivors of sexual violence, and it coordinates the National Advocacy Project, which delivers advocacy services to survivors across Scotland.
Thank you. Then, Dr. Scott, your
Yep.
organisation, Scottish Women's Aid.
Scottish Women's Aid is the leading third sector organisation, I can't believe I'm reading this, in Scotland, working to end domestic abuse and promote effective policy and practice responses for women, children, and young people who experience domestic abuse. We are the national umbrella organization for 34 autonomous grassroots services that deliver direct support and advocacy to women, changes to women, children, and young people across Scotland. Our members are local women's aid groups that provide specialist services, including refuge accommodation, information and support to women, children, and young people. We operate Scotland's Domestic Abuse and Forced Marriage Helpline, which is a 24-hour, 365-day service.
Dr. Scott, something that occurred to me, and I think you're going to develop this as you go on in your evidence, but perhaps useful just to touch on it here. How on earth did Scottish Women's Aid, particularly through the use of refuges, operate during the pandemic?
Well, we'll definitely talk about that when we get to housing and homelessness. Yes. But it was a very significant challenge, and I would be really remiss if I didn't sort of note here the above and beyond efforts of the staffs across Scotland. And I think it's worth noting also that 2 of our services are BME specialist services, so some of what I will say is very much informed by Hemmet in Glasgow and Shakti in Edinburgh. What happened in terms of housing and accommodation was that it was a perfect storm, really. The response to COVID and the safety precautions that had to be made meant that all of our communal refuges, which is the majority of refuges in Scotland, had to be reduced to 1 family, for the most part, I should say, not all, which absolutely very much constricted capacity. And at the same time, local authority housing allocations processes were for the most part frozen or operating at a snail's pace. Now, the way refuge generally works is that women come to us from a variety of sources, usually in an emergency situation or often in one, and they stay for a certain period of time, but then they get rehoused through the local authority or some other mechanism, but mostly through local authority housing. When that allocations process is frozen, there's no back door. And so our refuges were full almost immediately. And then, so we spent enormous swathes of time during the pandemic in which there was no emergency accommodation for women experiencing domestic abuse.
Thank you. Right, can we move on to the overview of impacts of the pandemic on women and children in Scotland? And again, Ms. Murphy, you want to add?
Yeah, could I just add something that about our group of organisations in terms of how they operated throughout the pandemic? So from our point of view, we engaged directly with government as much as we possibly could. We tried to undertake research to feed in real time to Scottish Government decision making, and through the parliamentary processes, etc., trying to get amendments made to legislation, for example, the emergency legislation that was going through. But also just to make one point that our partner organisations were keen for us to make was that even though they were providing legal advice and direct services to women who've experienced, for example, rape and sexual violence, their workers often weren't recognised as key workers and couldn't get access to childcare facilities, etc. So there was an element where a lot of the work that was being done by the organisations we represent, and particularly those providing direct services, were providing vital key services but weren't recognised as such. And it goes back to that point of view of gendered decision making. We weren't recognised because there wasn't the gender competence to recognise that we would be essential.
Please don't think I was excluding you from that earlier question. It was just really just as a matter of pure practicality I was interested in on women's aid, but I'm aware of what you go on to say in relation to the input of your organisations into policy decision making, so I am aware of that, so thank you. Yep, right, can we go back to the overview of the impacts, please, and whoever would like to read that section, and we'll pause at various points just to obtain some clarity about various matters.
Although each organisation is separate, there is a shared recognition of the disproportionate impact that the pandemic and lockdown measures had on women, children and young people generally, but particularly in relation to those experiencing domestic abuse. COVID-19 has exacerbated existing inequalities and made the most vulnerable and under-reached communities more vulnerable and isolated. In looking across all policy areas, including justice, health, employment, education, children and families, and housing and homelessness, a key concern of our organisations has been the cumulative impact of the increased risk of harm to women and children.
Can you just explain what you mean by the cumulative impact? I think we can probably guess at it, but
Yeah.
you have the knowledge, so can you tell us?
I think that there's, first of all, just contextually, we were coming into the COVID crisis on the back of a decade of austerity measures where services had been cut. There had been cuts to social security. Women are more likely to access public services, so the cuts that were made to public services in that period had had a very disproportionate impact on women. So women, and particularly marginalised women, were already in a vulnerable position as we entered the COVID crisis. And throughout the COVID crisis, there was, I would say that the cumulative impact speaks to lots of individual decisions where there was not the appropriate gendered competence and expertise fed into those decisions. And those decisions, in the simplest term, chipped away more and more at women's stability, their financial situation, their safety, and it has had a considerable cumulative effect across a very wide range of policy areas.
Thank you. Thank you, that's very helpful, thank you. Going on to the impacts on the physical and mental health of women.
Yeah. So the full gendered nature of the health impacts of the COVID-19 pandemic are still unknown. Although women are more likely than men to seek out medical advice, this is not reflected in their health outcomes. Women are almost twice as likely as men to report that their mental health worsened due to the pandemic. Uncertainty, fear and long periods of isolation compounded existing pressures linked to unequal gender roles and norms, including the disproportionate burden of caring responsibilities carried by women, leading to increased experience of anxiety, stress and depression. It is likely that women experiencing existing marginalisation due to socioeconomic exclusion or intersecting discrimination have been particularly impacted. Our organisations witness directly a heightening of mental health problems and psychological distress, particularly for victim survivors of domestic abuse or gender-based violence.
Now, I don't want to go into numbers, but are you able to say the level of the increase in the reporting of mental health problems? Is it appreciable? Was it, if you can give a general indication rather than how you would put it?
I mean, I think a general indication would be in real time, the organisation among us who are service providers were reporting consistent acknowledgement and people coming back to them in the delivery of services reporting that their mental health was deteriorating, that they were under extreme pressure for a variety of reasons, some related to just the excessive pressure of trying to deliver homeschooling, childcare, and possibly doing work at the same time, not being given enough support, not being made redundant. And then also if you add in the additional dimensions of for people who were living with abusers, for example, you can imagine the level of pressure people would be under. So our services were witnessing that. But I would also say as well that subsequently all of the research that we were doing at the time, whether that's on people's experiences of maternity services, whether that was the experiences of carers who were a group that were under excessive amounts of pressure, the issues around mental health and people's desperation, people's anxiety, and people just not seeing, how they could go through the next months, weeks, under the level of pressure they were under, we were seeing that coming out consistently, regardless of the research we were doing. That was a very strong message that came through in everything we did in the pandemic, and also, I should say, subsequently, it continues to come through.
Right. You're perhaps wearing your engender hat and giving this piece of information. You're talking about research. What research was going on, either through your organisations particularly, or for women's organisations generally, about the impact?
So we were doing research on a wide range of different areas. We were engaging with women through our website, through our social media, asking people to tell us about their experiences in real time. We were doing research on, as you know, maternity services, the experiences of carers. We also conducted, with women's organisations across the UK, a survey in May 2001, and that has quite a strong focus on mental health. 2/3 of women that responded said that staying positive day to day had become harder since the last lockdown. That was significantly higher than men, which was 36%. Women were almost twice as likely as men to report that their mental health had got worse since the start of the pandemic. And women in lower income households were more affected. So we were trying to capture data like this as we went through the pandemic and on a wide range of issues. I don't know from the service provider side if you were doing similar research.
I guess there's two things that popped to the top of my mind, although there was multiple pieces of research done. Quite a bit of qualitative research funded by the Scottish Government around the experiences of children and women in the context of the pandemic and domestic abuse. But I know that Amina, for instance, did some significant survey work with Black and minority ethnic women, and we certainly did surveys across our service network, resulting in a report which I think we've appended. Yes. To this. I think the other thing to point out is, and this is where gender really makes such a difference, is that the vast majority of people who work for our organizations are women. And all of the women in all of the staff in Rape Crisis and in Scottish Women's Aid who were providing coalface services were women. And so they were not only experiencing the stresses of trying to support people who they care deeply about. I remember a discussion with a children's worker who was talking about children who she saw regularly in school, and when they shut the schools, and in her district, children experiencing domestic abuse were never recognized as vulnerable, so they weren't even considered for being allocated to hub schools, that suddenly, and also children living with their abuser, had absolutely no access to the support that they'd been getting on a weekly or bi-weekly basis. And the worry and the fear for her was that child was going to wind up dead. So I think it's really important. Plus, on top of all of that, she had children at home. She had, all of the things that Kat described. So it would be an absolute miracle if mental health didn't, and stress and anxiety didn't suffer under those circumstances. Yeah. And many of them easily avoidable if people had thought about the gendered consequences of their decisions. So, for instance, what Kat was talking about in terms of decisions about who would be a key worker. If anybody had, domestic abuse and sexual assault is not a niche problem. It affects somewhere between 1 in 3 and 1 in 4 women in Scotland, and 1 in 5 children live with domestic abuse. So there's no excuse for not considering the impact on those populations when you were closing the schools, when you were establishing who were key workers, when you were thinking about housing allocations, all of those things.
Ms. Murphy, I think you want to come in as well.
Just very, very quickly. Just to say that there was work done by One Parent Families Scotland. I mean, 92% of single parents in Scotland are women. And that was a group of people who were under particular stress. Carers Scotland as well, I draw the inquiry's attention to work that was done by Carers Scotland, which found that 72% of carers reported that their mental health had deteriorated since the start of the pandemic. So lots and lots of kind of charitable organisations were trying to engage with their constituencies to find out what was happening, and we were getting that feedback very strongly that people's mental health, particularly those that were under a lot of pressure, was really under kind of strain.
Can I ask you this? Was this particularly the stress, the anxiety, the mental health impact, was that something that became apparent very early in the course of the pandemic, so far as the impact on women was concerned?
I would say yes. I would say that, and I think as well that the point as well is I think that going back to again our earlier point about gender competence, it could have been entirely anticipated, yes. And I think that and this is not Scotland specific, it's globally, but there was an inbuilt assumption in the decisions that were made was that the responsibilities of the state could by and large just be offloaded to women with regards to childcare, etc. And we could have anticipated very easily that that was going to create enormous stress, yeah, for the vast majority of women.
Yeah. I think, I don't want to become legal about this, but we in law we're very familiar with the concept of what we call reasonable foreseeability. Now, without defining that for you, because I'm not entirely sure I can, but without defining it for you, just applying what I think would be just a general understanding of that, at the start of the pandemic, do you think the potentially adverse impacts on women that you have been describing could have been reasonably foreseen by decision makers?
I think it's what we were saying about gender competence. The reasonably foreseen, absolutely, if there had been gender competence in the decision-making and in the institutions that were making decisions. And it actually, you know, as I said, it doesn't take much to step back and say, well, how will this impact different populations in Scotland? And this is what we were talking about in terms of when you look about what you were calling gender incompetence. It operates with a male default. So it assumes that the programs and the services and the policies that are being designed, which are designed with the male model in mind, good, bad, and indifferent, is appropriate for the rest of the population. And can I say for the majority of the population? But a failure to understand that male default gaze is built into decision-making means that you make decisions that are deeply incompetent and harmful.
I think one of the points you make later in your statement is the message of stay safe at home.
I'm sorry?
You make the point later in your statement that the message coming from government was stay safe at home. Oh.
Yes.
For the benefit of, as we would say in legal circles, for the benefits of the notes, you shrugged at that.
Oh, I know. I mean, and to be fair to certain officials in the Scottish government, when we raised it, they were quick to understand the mistake, and Police Scotland also. But the damage had really pretty much been done, in the sense that the messages were really clear and loud out there that restrictions on movement were going to be trump pretty much everything else in people's daily lives. And obviously, for those living with domestic abuse, especially now because their abuser was home all day too, that just was an extraordinarily insensitive message. And when, I have to say, when we went to Police Scotland with it, they were like, absolutely, domestic abuse is one of our highest priorities. We won't change our response to domestic abuse. But that message essentially was that the status quo was in place, and it, instead of saying very directly, if you're experiencing domestic abuse, don't stay, you're not safe at home, and you're not safe at home, these are the things you could do.
I think you want to chip in there?
Very, just very briefly, I think the other context which I referenced just quickly is that there was a huge amount of learning that had been gathered in recent history. So following on from the 2008 financial crisis, we had saw the impact that had on women's quality of life, their financial situation. We had evidence and learning from that crisis. We also had been through a decade of austerity. There was research. There was a lot of kind of data that had been gathered. So just to give you one example, Women's Budget Group had found that the vast majority of cuts that were made to public services and to social security came directly out of women's incomes. So we knew the vulnerability that existed with women going into the crisis. I would say as well that within Scottish Government, the people who were there to be gender or equality experts did an absolutely sterling, fantastic job. The issue is that there's not enough of them, and the generalised knowledge is not where it needs to be. The generalised competence is not where it needs to be. And just finally, I would say the Scottish Government were very quick to react and did reasonably well, I think you would say, with regards to violence against women, but the broader issues of women's financial situation, women's health, etc., that wasn't responded to in the same way or to the same extent.
Thank you. At paragraph 16 of your statement, you give two quotations. I know where they're from because I've seen them in the documents you provided for us. These are two statements. One is October 2020. Well, in fact, they're both October 2020. One is January 2021. I think it's interesting if somebody would just read those statements.
Attempting to homeschool children whilst working from home alone, most of the time as my partner was working in a hospital, was one of the most stressful situations I have encountered. I felt like a failure as a parent and an employee, constantly on edge, anxious, losing my temper with the children, no contact or support from school, family shielding. I felt completely alone, isolated and close to breaking point a lot of the time.
Yes.
Mum of two, January 2001.
21.
Oh, 2021. Thanks, Marsha. I feel like I'm failing in every area of my life right now. I'm failing as a mother, as a professional woman, as a teammate, as a daughter. I wake up every morning with a fear for what the day may hold. My sleep is broken and I have nightmares most nights. The weekends bring no joy. It is relentless and I am exhausted.
And the final one?
Final one. Anonymous, October 2020. I had COVID way back in March and I am still not fully recovered. My lung capacity is greatly decreased. I now have chronic fatigue and I am unable to concentrate on anything. I was made redundant from both of my jobs. I have attempted suicide twice since lockdown began and I have not been given any meaningful help from my local mental health team. I am struggling to hold on.
Now, do these represent a broad range of the information that you were getting, or your organisations were getting at the time?
I think they're a tip of the iceberg, and I think when we're talking about intersectionality, it's a good reminder for us about the fact that, you know, women are 52% of the population, and that the levels of their resilience are very much affected by race, you know, ethnicity, whether they're exposed to violence, et cetera. I was just thinking about the question about whether we noticed these impacts early in the pandemic. I think we saw them early in the middle, and we're still seeing them now. And it's really, I remember the helpline responses. So we had a 70% increase in calls to the helpline for the same period shortly after the beginning of the pandemic. But what we didn't have was an increase in the first couple of weeks after lockdown. And when people asked me about that, because there'd been reports from down south that were not our experience nor the other helplines in the UK, that, you know, that that domestic abuse was going through the roof, and our helpline did not have a significant increase. And our response to that was, that's because women are out trying to find loo paper and, toilet paper and figure out how to homeschool their children. And, the sort of Maslow's hierarchy of meeting the needs of their families. And then, as time went on, they began to explore what their options were and how, what choices they had in the face of domestic abuse. And their choices are so constrained if you think about their space for action for people who experience all of their human rights most of the time. Women just start here, because there are no women in that, but women experiencing domestic abuse are here, and children are here. So they began to explore, and the majority of the increase in calls that came after that period were asking for information about could they leave. There was a woman who wanted to take her children and go see her mother in England, but she was worried that the British Transport Police would arrest her and send her back home. I mean, all of these things about just trying to find space for action. And it carried through from the beginning through the middle, and the sequelae at the moment in terms of staff in our organizations is they're just really suffering. And I don't know how long the recovery is going to take.
Thank you. Can we go to paragraph 17, please, where you talk about gendered issues regarding healthcare? And perhaps, again, somebody could just tell us about those.
Would you like me to read it?
Yes, please.
Yeah. So, gendered issues regarding healthcare included negative impacts on access to perinatal, maternity, fertility and sexual health services, the suspension of breast and cervical screening programmes, and inconsistent advice and support for pregnant women around the risks of COVID-19 for mother and child. Pregnant women were unable to have someone with them at healthcare appointments, and lockdown restrictions impacted access to maternity wards for partners, which in some instances meant enduring traumatic experiences alone, for example, miscarriage.
Just pausing there, inconsistent advice and support for pregnant women. How significant was that in the experience that you've gleaned from your members and those who you advise?
I think, and this refers to the research that we submitted that
Yes.
you're aware of. I think in terms of the inconsistency in information, that was across quite a wide range of things and evolved as the pandemic went on. That related to the initial stages where women weren't sure about their levels of risk, shielding, etc., and were being given at times inconsistent, shifting information. And struggled to find the information sometimes. And then it also related as well to vaccination. So we had, in that research, we got a lot of feedback from women telling us that they got very conflicting accounts of vaccination. So we had examples of women who had a good experience and got the information they needed and had great experience with healthcare workers. We had other women who had educated themselves through the internet. One woman told us that she had used social media to find an academic and read all of their research. But then when she went to access services, the healthcare worker that was delivering her vaccination was kind of congratulating her for being brave, but saying that she wouldn't have necessarily have made that decision. Women were reporting very inconsistent information from on vaccination from the healthcare workers they directly engaged with. But I do want to stress many had good experiences, but there were a critical mass that didn't. So the lack of information went across a range of areas, and then also in terms of whether partners could access services with them, come to appointments, etc. That varied. The information chopped and changed, and at times it felt very arbitrary at different stages in the pandemic whether women would have that support or not, and it seemed to be down to individual decision making at some stages within the pandemic.
Yes. Individual decision making by whom?
It would be hard to tell, but I would assume either the decision makers in those services or within the health board areas, for example. I think probably at the earlier stages in the pandemic it was more national decision making, but as things started to open up a bit more, there was more likely to be inconsistencies geographically in terms of whether women on a particular week or month, for example, could bring their partner along to an appointment.
Thank you. You mentioned in paragraph 18 a number of advances in abortion care, and you also mention reproductive health needs, and again you say in relation to abortion rights campaigners had for many years advocated a safe telemedical service. Can you just tell us what that was, please?
Yeah, so very early on in the pandemic, the Scottish Government introduced telemedical support for abortion and medical abortion which is medication pills that can be taken at home to induce abortion. Yes. That was something, I believe, if I remember correctly, that there was a bit of a U-turn by UK government, because obviously Scottish Government is to a certain degree bound by UK decision making around the Abortion Act, and there was a U-turn by UK Government, and there was a provision of these services in Scotland, and these have been services that have been available for some time. They have been services that we have advocated for a very long time, and it's quite sad that it took a pandemic for us to get them, but we were very grateful that they were introduced because they made a potentially catastrophic situation with regards to unplanned or unwanted pregnancies more tolerable for women in Scotland.
Can I just add something?
Certainly, Dr. Scott.
And I think this is one of the areas where geography really needs to be paid attention to. Geography and decisions that were inconsistent across health boards. So we know that some health boards, for instance, were quite quick to provide access to telemedicine, and others were still for quite a long time requiring women to travel to their doctors or to a hospital to pick up their medication. Now, when you live in a very rural area in the north of Scotland, what we heard was stories about women who were had picked up their medication and no, they had to go to the local hospital or practice to take the medication in front of a doctor. And then because of the long distance involved in traveling back to home, the medicine had already started to work, so they started to go through a medically induced abortion in the car. And they knew that, and they had this is what I'm talking about, constrained choices. They had no other options. And the officials making those decisions really will have known that that was the case also.
Okay. Just in paragraph 19, you mentioned there's a 19% increase in the abortion rate in Scotland in 2022. Yeah. Is that in any way relevant to what we're talking about today?
Yeah, I think absolutely. I think it's very relevant. And just to add to that as well, there was a particularly sharp rise of 25% among young women aged 16 to 19 accessing abortion in that period. And that was following a 14-year fall in that age group accessing abortion. So there's something has happened of significance. We would, one of the things that we would like is more research and learning to be done in that area to see exactly what were the drivers. We would suggest and anticipate that the drivers partly were socioeconomic within the pandemic and the subsequent cost of living crisis, that many women lost their jobs or were furloughed and earning reduced wages, were under an enormous amount of pressure. That some women who, for example, disabled women might have been under particular pressure because of the fear and anxiety and the unknown that existed around COVID-19. And then also for young women, there was a lack of and inconsistencies in sexual and relationships education that's delivered through school because the education system was so disrupted. So we would hazard our best guess based on years of working on this issue. We would imagine that they were key drivers into that increase, but there certainly needs to be more learning about that and more research, I think.
So I suppose at this stage you can make an informed and intelligent guess as to if there was a causal connection between various aspects of the COVID pandemic and the restrictions and the limitations imposed and that increase in abortion rate.
Yeah. The one finding is also relevant to that is inconsistencies in being able to access contraception. Yeah.
I would just like to add to that we know that domestic abusers are likely to use women's sexual health as a very powerful tool. So both restricting access to contraception or insisting on abortion when it was against the woman's choices. So the fact is that, you know, women can often have a bit more control over the questions of their fertility and often, although often have to engage in coerced sex because of the abuse that they're experiencing, really high rates of that. The reality is that in the pandemic, because women were getting such mixed messages about whether they were allowed to leave, how they were going to access, both in terms of finance, but in terms of restricted access to health services, getting contraception will have been much more difficult.
Okay. You give provide a quotation for, again, an anonymous source from September 2020, and this is in relation to from somebody who was pregnant. Yeah. Could you just read that out, please?
Sure. Being pregnant and re-entering lockdown situations is awful. I relapsed into my eating disorder. I have some CPN, which is community psychiatric nurse support, from the West of Scotland Perinatal Mental Health Service, but they can't offer me as much because of face-to-face restrictions. My husband has been able to attend scans, but not emergency appointments or routine ones. What will happen at birth is a mystery, and women are being stripped of choice, little to no option for home or water births, births that are highly medical and full of interventions, rushed to when giving birth and then rushed out the door. I have very little trust my birth will be a positive experience. All in, I'm an anxious mess. My eating disorder is back. My borderline personality disorder symptoms are heightened despite 2 years of no symptoms at all. And I feel a distinct pressure to comply as a good girl and not push for the birth experience I want to protect my own body and mind.
Okay. Right, now we turn to health and social care workers.
Yeah.
And obviously, this is an area in which women are disproportionately involved.
Yeah.
So could you read on in paragraph 20, please, somebody?
Yeah. Women represent a significant proportion of frontline workers in the health and social care sector. During the pandemic, about 80% of health and social care workers were women. They put their lives and their health at risk to look after patients during the pandemic while being undervalued, underpaid and underprotected. There was a lack of appropriately sized and fitted personal protective equipment, PPE, for women, meaning they were at increased risk of contracting the virus during the course of their work. They were also exposed to unprecedented levels of death and grief impacting their mental well-being, staff shortages, the inability to attract new staff, unprecedented levels of stress and pressure, fears of passing the virus to patients, colleagues or family members, and a lack of recognition for social care staff compared to the NHS workforce have negatively impacted mental health and morale within both the health and social care sectors.
Carry on, if you would.
Yeah.
If you would carry on reading all of paragraph 21, including the quote.
Of course, yeah. Workers in the care sector have faced an increased burden of risk. Information from National Records Scotland indicate that the death rate from COVID-19 for social care staff was higher than the average for all occupations in Scotland, 14.4 per 100,000 for social care workers, compared to 10.3 per 100,000 for all occupations. Mother of 2, March 2021. I was a key worker when the pandemic hit, and with 2 school-age girls at home, I was filled with fear and dread about how I could manage my work and my family. My husband's job is also so busy that I knew he couldn't take the brunt of things at home. I lost 4 of my clients within 2 months at the start, and there were so many others I was worried about. I was part of a busy assessment team, and the decisions we were being asked to make scared me. My job role also entailed speaking about a lot of difficult situations in relation to domestic abuse, mental health, severe sickness and illness, and the things I spoke about in my day job just couldn't be spoken about at home with 2 young, impressionable girls in the house at the same time. I had absolutely nothing left to give them, and my boss's response was that he wanted me in the office more and out doing visits more, even though we had no PPE and there was nowhere for my girls to go.
One point you raise, and it may seem slightly insignificant, although it probably isn't. You mentioned in paragraph 20 about inappropriately sized and fitted PPE. Now, this is something that the inquiry has heard about, heard a little about in the investigative work that we've been carrying out. Can you explain how that came, well, not how it came about, but how it manifested itself?
I think just at the outset, I would say that, going back to one of the earlier points Marsha made, is that all of our structures, unfortunately, in society, for the large part, the default is a man of a certain age who is more often white, does not have a disability, etc. And what that means is that so much of our society is designed with that person in mind. So PPE was designed in large part, and the PPE that was accessed in large part was designed to fit men, and therefore was oversized for most women, and therefore compromised their safety. And the Royal College of Nursing raised concerns about this, and much of the information that we've gathered has been via these sources that were working in those sectors, and particularly for social care workers. They had less access and struggled more to access even ill-fitting PPE. So that was kind of, and then there's also the TUC has done some work as well, saying that for Black and minority ethnic social care workers, they struggled to get access to PPE even more so. So there was a real serious issue, but at the beginning of that, the point is that much of what was bought wasn't designed for women, and it wasn't properly recognised. There might have been more access within the NHS potentially to better quality, but social care really struggled.
Thank you very much. At 11 o'clock, or just beyond.
By all means,
Thank you.
Take a course for now for the stenographer's sake.
Thank you.
Sure.
Very good. Thank you. Right, now, when you're ready, Mr. Gale.
Thank you, my lord. We were dealing, or had reached the point in your statement where you're going on to talk about domestic abuse and sexual violence. It's paragraph 22. And again, I think it would be helpful if you just read through some of that.
Sure. So domestic abuse and sexual violence, and this will be just a tip of the iceberg, but women and children experienced an intensification of domestic abuse and gender-based violence during the pandemic. Scottish Government reporting on how the COVID pandemic affected the justice system found in October 2020 that recorded crime was 7% lower over April to September compared to 2019. However, domestic abuse incidents were 8% higher in April to September 2020 compared to 2019, with 34,106 domestic incidents recorded. And it's really important to understand that a small minority of domestic abuse victims report to the police, and that's where this data will have come from.
And I think you provided us with the data. Yes, carry on, please.
Domestic abuse is a pattern of behavior that instills fear and is used by abusers to maintain control. The pandemic did not cause domestic abuse, despite many media reports, but measures taken to address the pandemic, such as lockdown, closure of schools, working from home, early release of prisoners, and reductions in the work of the courts, provided additional tools for abusers to exercise control and removed opportunities for women to access services, access justice, or seek help in other ways.
Please continue.
Due to lockdown restrictions, women and children were subject to heightened monitoring and control by their abusers, with limited ability to move around freely or, for example, to take their children and flee. There was less access to safe spaces or support from family, friends, or community services. The full and longer-term impact on victims and survivors has yet to be understood, particularly the impact on children and young people living with coercive control during lockdown. Not only were children not safe at home, living with an abuser, but all the places where they were usually safest, school, nursery, or after-school clubs, had suddenly been taken away from them.
I'd like to just pause and reflect on that point. You've provided, as you said, the inquiry with a number of documents. One of those documents is SCI SWR 00003. I'm sorry, these reference numbers are rather complicated.
I know exactly which one that is. I have no idea.
Well, I'm very glad you do. It's SCCJR.
Oh, yeah, the Scottish Centre for Crime and Justice Research.
Yeah. And this, I think, is a paper prepared by Ms. Burnham and Ms. Brooks-Hay from Glasgow University, and is entitled Delays in Trials, the Implications for Victim Survivors of Rape and Serious Sexual Assault, an update. It's dated December 2021. And if that could be just put on the screen and go to page 2 of that document. I think at the head of page 2, we can see concerns about the effects of COVID-19 on the processing of sexual offence cases in Scotland, and the disproportionate impact delays have on women and children were flagged early in the pandemic. And that's the same author's paper from the previous year. The cessation of jury trials for 3 months during the first COVID-19 lockdown in 2020 significantly exacerbated the existing backlog of these cases. Well, that's briefly the context of what is there. I'd like you to go to page 5 within that document, and midway down page 5, there is a paragraph which begins, research has also highlighted. Could you just read that out? Read the first 2 sentences of that out, please.
Research has also highlighted the extent to which the children of those who have experienced serious violence are themselves affected by this experience. That's research done by Jane Callahan in Sterling, 2015. Where cases are delayed, there are particular implications for children in light of their age and the proportion of their lives spent with a parent involved in criminal proceedings and who may be called to give evidence in court.
Yes. Now, this, I think, Dr. Scott, is something that you've taken up particularly, and I'd ask you to look, if you would, at another document, please. This is SCI SW 0, and then the 5 zeros, number 5.
Oh, that one.
And I think this is you gave evidence before a parliamentary committee, the Scottish Parliamentary Committee, the Equalities and Human Rights Committee. You gave this on Thursday, the 28th of May, 2020, so very early in the pandemic. And I think if we can see on numbered page 1 of that document, go on a little bit, please. Yes, yes. I think we can see that this is the Equalities and Human Rights Committee, and what it was considering was COVID-19 implications on equalities and human rights. Could you go on in that document, please, to page 28? And it's numbered in the top right-hand corner. Oh, sorry, it's column 28, but the number is in the right-hand corner. Column 28. Found it. In the right-hand column, column 28 of that parliamentary report, I think if one goes just below halfway down, you found your name, Dr. Scott. Can you just read out what you said to the committee at that stage?
Yep. So the reference here is to Giri Palabotu, who is our manager of Shakti Women's Aid, which is here in Edinburgh. I echo everything that Giri has said, and I have a few other things to highlight. First, children and young people risk being considered as collateral damage when we discuss domestic abuse. In reality, they are victims just as much as their mothers are. Not only are they not safe at home when they are living with an abuser, all the places where they are usually safest, including school, nursery, or after-school club, have been whisked away from them. We are really struggling to get them in school places, and this would have been in the hub schools. There are some.
I'm sorry, you go on, and you make one of the points that I think you made earlier about remote and rural areas.
Indeed. Do you want me to read that?
You do, yes.
There are some complexities with that. It is particularly difficult to do that in very remote and rural areas. I'm happy to share some details on that. The failure to recognize that children are in situations of domestic abuse concerns a very large proportion of the vulnerable children in Scotland.
Right, I think we can probably just pause there. To a certain extent, this is going slightly off-piste from what you're talking about in relation to the damage on children, but perhaps it's a useful point at which to give you an opportunity to emphasize a point that I think you make and continue to make. Could you go to the column 31? It's the left-hand column on the page. Down towards the bottom again, your name appears, Dr. Scott. And I think, again, it would be useful if you would just read what you said to the parliamentary committee at that point.
Well, it references a question above. Can you just go up a little bit so I can see what the question was that I was answering? Okay, that's good. I think it's about government guidance in lockdown.
Yes, I think we're on the wrong page.
One page down.
Oh,
31.
thank you.
Yes, that's one. It's what you say at the bottom of column 31 and onto column 32.
It would be remiss of me not to point out that at the end of the day, we want to stop putting sticking plasters on domestic abuse, whether we are in a pandemic or not. Domestic abuse is itself a pandemic. In order to end domestic abuse, we need refuge and services, but we also really need to choke what I call the feeder system for domestic abuse, which is women's poverty, and the failure to have them at the table when decisions are made about the economy and, wait for it, issues such as local housing policy. We need to grasp the nettle on all of the things that Engender points out again and again. The reality is that women have so few choices in the context of domestic abuse because they are constrained by unpaid care, having to find ways to put food on the table for their children, and other issues. I always need to put that marker down. Do you want the next one?
Can we can pause there, as I think that's, we can obviously read the remainder of what you say, and it's obviously of considerable significance, but I think it was helpful. We've just got that little, I wouldn't say little point, but that brief point in your evidence across. Right, can we go back to your statement, please, at paragraph 26? And you're dealing here with housing and homelessness.
Can I go back just on one thing that we didn't quite touch on when we were in that earlier section?
Yes, certainly.
On children, which is one of the systems that I think is most intolerant of gender differences in Scotland is civil court decisions around child custody and child visitation in the context of domestic abuse. And all of that was exacerbated during the pandemic, and we heard multiple stories on our helpline and through our services about abusers who had visitation with their children and did not return their children. And the system, often what women would call the police and say, my children haven't been returned, and the police would say, oh, well, this is a civil matter, we can't get involved, or the abuser would say, well, we've had COVID and we can't, bring the child home because of shielding, and all kinds of excuses that were based on, and some of them were probably real, I'm not arguing that, but the system was really insensitive to the risk to children in the context of child contact that had been court-ordered, which was risky to begin with, because the usual mechanisms of monitoring and protecting children in terms of returns to their primary caregiver just did not work. And we saw multiple examples of either perpetrators who threatened not to return children in order to enforce control over their mothers, or the children themselves being exposed to extended periods with fathers who were not holding them in their own interests.
Do you see that as being, because of the restrictions on court access during the pandemic, one of the difficulties with the availability and the access to civil courts, rather than just, as you've been emphasising earlier, the access to criminal courts.
And I very much want to talk about criminal courts and the problems with that, but I guess what I'm saying is that it was already a perilous situation because of the tendency in Scotland to award contact in unsafe situations. And, but the protections the few protections that were in place just did not work in the context of the pandemic. And that will be because elements of the system, whether it was police, whether it was sheriffs, whoever it was, misunderstood or minimized the risk to children of allowing unfettered access to them by their abusive parent.
Okay. All right, can we go back to housing and homelessness, please?
I am.
And to a certain extent, I suppose that follows on from what you've been talking about. But if, again, you could read through paragraphs 26 to 29, please.
Sure. And some of this I referenced earlier, but the pandemic increased the risk of homelessness and insecure or unsuitable housing for women, including women seeking to leave abusive partners. There was an increase in women seeking crisis accommodation or moving in with family members for safety, notwithstanding lockdown restrictions. There was an increase in stalking and harassment from ex-partners, physical and online, which resulted in more women looking to move home for safety. Almost all local authorities in Scotland froze housing allocation processes, which significantly compounded issues for women. Women's refuges were full, and there was no scope to move women and children into permanent housing, and a consequent inability to provide accommodation and support to new referrals. A quarter of refuge protection provision in Scotland is shared, and social isolation measures resulted in a reduction of available spaces. This was the backdoor issue that I was referencing before. There was particular difficulty for women with insecure immigration status and women subject to the no recourse to public funds condition in accessing housing.
Yes. I'm going to put to you a scenario which I think we've seen in a number of the statements that we've seen and also some of the information we've been given. You have a relationship, man and woman living together, and perhaps at the time it was contrary to some of the lockdown restrictions. Did you come across situations where one of the partners in that relationship would, if it were an abusive relationship, and let's assume it's the man who was being abusive, in that situation, there would be a threat of exposing the other partner for breaching lockdown restrictions?
Yes, I think we referenced that actually in our statement.
Just like to understand that that is something that that you came across.
We came across accounts of abusers threatening to when a woman, for instance, went to her, tried to move in with her family, but also threats to call the police if she, as I said in the case with the woman who was trying to take her 2 children on the train to her mother's to get away, that he was going to call the police because she was breaking lockdown restrictions. And again, we saw cases, the few court cases that did go ahead, where there were perpetrators who the proceedings were delayed 2 and 3 times because of supposed 2 and 3 cases of COVID. So, abusers have a very big kit of tools that they use to control children and women, and lockdown restrictions just was like a Christmas gift for them, because not only were they trying to control them, but now the state was, and the state was underscoring that women and children had even fewer choices.
Okay. Could we return to your statement again and to the labour market and financial equality? You've set out in paragraph 30 a summary of the various features of this, and perhaps you would just go through the A to G points that you've set out in paragraph 30.
Sure. So the pandemic exacerbated existing gender inequalities in Scotland. In terms of financial equality in the labour market, women in Scotland were more likely to have been furloughed and for a longer period of time, less likely to have their pay topped up by their employers while on furlough, more likely to work in a sector that was shut down or significantly restricted by public health measures such as hospitality or retail. And this was especially the case for women from ethnic minority backgrounds and younger women. Were more likely to have lost their job or had their hours reduced, bearing the brunt of the increase in unpaid childcare, home learning supervision and care for adults in the home when schools and nurseries were closed and social care packages were reduced, making it difficult to do their paid work from home where this was required by their employer. More likely to be key workers, representing about 80% of those in Scotland, but were undervalued, underpaid and underprotected, and were also significantly more likely to have long COVID.
Just on that last point about long COVID, is that something that you've, in the work that you've done, that has been brought home to you?
Yeah, and it's emerging more as you know, things progress. But yes, there's been research that the women were disproportionately exposed to COVID as the majority of key workers, and have had more experience of long COVID, and women experience already existing health inequalities. So there's not clear evidence yet on what has been the driver for that. Women are, for example, more likely to experience autoimmune disease, for example, and post-viral illnesses. So that could be a factor in it, but there's also certainly a driver from the perspective that the vast majority of jobs where there was high levels of exposure to COVID were done by women.
I give then two examples of situations that have been presented. Please don't think that I'm minimising them, but I'd like to just take those as read.
Sure.
And can we go on to paragraph 31, where you conclude about the disproportionate impact?
Sure. So the disproportionate impact of the pandemic on women's employment and job disruption has potentially far-reaching consequences for women's equality in Scotland across a number of policy areas, including employment, poverty, including child poverty, social security, violence against women and health. COVID exacerbated gendered patterns of care, worsened women's poverty and rolled back progress made on women's equality and rights. COVID-19 job disruption had a particular effect on low-paid women, disabled women, racially minoritised women and younger women.
Can you just give some context to what you say that COVID rolled back progress made on women's equality and rights?
Yeah, I mean, I think it's a big question right across. It's a big question right across these areas. But with regard to, so there was impacts in terms of violence against women. There was impact in terms of women's experience of health. But in the labour market, there is a high level of occupational segregation in the labour market in Scotland, where men tend to be employed or predominate within higher paid, higher status jobs, and women predominate in lower paid jobs, much of which made up these high exposure jobs during COVID. They tend to be on lower pay, 0 hours contracts within this job work, within these particular areas of employment. And we had seen some deterioration in that over the austerity period in terms of the quality of work, for example, in the social care sector. But the pressure that has been put on the social care sector, which was underfunded, undervalued, and wasn't as strong as it could be prior to the COVID pandemic, that has been exacerbated by the extreme pressure it's been put under. And it's even weaker now in many ways, and women's employment within that sector, women have suffered quite significantly from that. So actually occupational segregation has always existed in Scotland, but we think that it's probably even more pronounced because of the way things have happened within the pandemic. Women were more likely to be in sectors that were shut down. They were more likely to be made redundant, for example. So across the employment pace, we're still actually trying to catch up with what the consequences have been for the very gendered way that the employment sector was interrupted. People didn't experience those interruptions in the same way. So, for example, men were far more likely to be in jobs where they could work from home. Women were more likely to have to go out to work. So we're still trying to understand the full impact, but it has been pretty severe, and things that we had worked for many years to try and address occupational segregation, it's moved the needle back to a certain degree.
Since the end of, I'm sorry, could I just follow that up with Ms. Murphy? Given the rolling back of progress, the falling back of the needle, since the effective end of the pandemic, has it gone in the other direction, or is it going in the other direction?
I think to some degree, some areas may have seen improvement, but I think one of the things we're most concerned about is at that kind of macro level is that first of all, the COVID pandemic laid bare the weaknesses in the system for women, and it compounded and exacerbated those weaknesses, and it's going to take some time to recover, so I don't think we're fully expecting it to jump back. But one of the things that we're also concerned about is that it really compounded one of the things that is the biggest driver of women's inequality, and that is gender norms and social roles. So women, and I said earlier that when things shut down, it was a transference from the state's responsibility onto the shoulders of women ultimately all across the world. And what happened was that women took on a far disproportionate amount of childcare activities, homeschooling, these things that had an impact on their working lives, their careers, their ability to earn money, their ability to progress in their careers, and it really compounded almost a kind of like a model of care and gender roles that we thought we'd left behind in the 50s to a certain extent, that there was a kind of resurgence in that in terms of the inequity of how things were shared. And I think it's going to take some time for us to get back to where we were before the pandemic around that.
Okay. Dr. Scott, I think you wanted to say something.
Yeah, just 2 points. One related to the labour market issues. It's pretty clear from economic analysis that if we're talking about women's poverty and children's poverty is really women's poverty in Scotland. The single biggest thing that could improve the women's poverty is improved access to the paid labour market. And as Kat has just pointed out so cogently, the reality is that not only was that, access to the paid labor market not good prior to the pandemic, but all of the things that happened in it have really reduced it. And we still can't tell what our colleagues at Close the Gap tell us. It's so unclear exactly what the lasting effects are on the labor market because the data is really confusing at this point. But the other issue I wanted to say is that in terms of domestic abuse, one of which is a driver of women's poverty, as poverty is a driver of women's domestic abuse, is that we've worked it had been probably 10 to 15 years to change the way the courts operated, to reduce the time to court for a domestic abuse case. And I know we'll get into the justice issues later, but it's such a good example of how we've lost some progress we had made. And we have lots of evidence that, especially from the research that was done on the specialist court in Glasgow years ago, which says that if you get a domestic abuse case to court within 8 to 10 weeks of the police report, then you've pretty much eliminated a witness attrition in terms of the complainer, and the attrition will be from the defense side. and you improve outcomes and evidence for all of those cases. And it took us 10 to 15 years, but we got it from what was about an average of 26 weeks down to about 12 weeks prior to the pandemic. And then with the consequences of court closures and court delays, that improvement was just wiped out in a matter of months.
Okay. We are particularly interested in the inquiry in unpaid carers, though it's a specific part of one of our terms of reference, and you refer to this at paragraph 32. It's a short paragraph, so can I just ask one of you to read it so
Sure.
we have it in front of us?
Yep. Women are the majority of paid and unpaid carers in Scotland. The pandemic significantly increased the burden of unpaid caring responsibilities on women, particularly due to the closure of schools and other care services and the introduction of isolation measures. Women provide most of the primary care and educational support for women. Other unpaid work, such as housework or household management, is predominantly done by women. The extent of women's unpaid work is central to their capacity to work within the formal labour market and has significant implications for their financial security.
I think that probably encapsulates very briefly but very clearly the position. You want to say something
Just
further?
very, very quickly, I just want two very quick things. One was the measures that we use to track progress, so gender pay gap, the gender pay gap reporting responsibilities and the reporting responsibilities under the public sector equality duty were suspended during COVID. They've been picked up again now, but there was a suspension which interrupted how we measure these things, and also We Worry sent the message that these things that can be quite easily dispensed of in moments of pressure. But just to pick up on one point I really want to make around unpaid care is that we were quite a way into the pandemic before the furlough scheme took any cognisance of people that might have to furlough because of the additional care duties that they have. So that was then introduced, and I know it's UK government, but even when it was introduced, there was such a low level of awareness among employers about the fact they were obliged to give people furlough if they needed it for care responsibilities, and there was an extremely low rate of take-up for that, and there was a really high proportion. I think it was in the region of, 71% of requests working mothers made for furlough for care duties were refused. And then the other thing is that the furlough scheme wasn't originally designed to take into account part-time work, the vast majority of which is done by women. So just going back to that competency and design issue, the support for people who were under enormous pressure to deliver care was really not there from the start in the way that it should have been. But I appreciate that largely sits with the UK government.
Can I just put to you something that I've seen, and see whether or not this is something with which you agree. I saw some time ago a report by Dr. Curry of Edinburgh University on unpaid carers, in which she indicated that during the pandemic to presumably the date of whenever the report was, which was earlier this year, there had been an increase in unpaid carers from round about 750,000 to over 1 million in Scotland. Is that something that you recognise?
Yes, that study, we followed that study carefully, and there was, there's now 1.1 million unpaid carers in Scotland, and there was an increase of nearly 400,000 in the first kind of year or so of the pandemic. I don't have access to data about how that might have come down, but we think that we don't think it's come down as quickly as it went up, certainly not.
Okay, thank you. Right, can we go on to impact on access to services? And to some extent, we've been touching on this all the way through, but I think one of the points you make in paragraph 33 is that data from May 2020 shows that call to Scotland's domestic abuse and forced marriage helpline were up 70% from the previous year. Was that something you expected?
Well, we didn't expect a pandemic, to be honest. It wasn't
let's
surprising.
accept there was a pandemic.
Yeah, we weren't surprised, and as I mentioned earlier, we didn't really see an increase until about 2 weeks after the initiation of lockdown, for the reasons that I've mentioned. But it was not surprising to us once we heard from the women calling the helpline and the men calling the helpline, but also from our services, that the lack of good information about the pandemic, the lack of clear messaging from police and justice officials about what the arrangements were for accessing court, and how restrictions on movement were to be applied if you were a domestic abuse survivor, were all just added to the massive uncertainty. And, that's what a helpline is for, is to provide information and access. But it was really, we had a call, for instance, I remember really clearly hearing from one of the call handlers, and this is when you were talking about putting the responsibility for the pandemic on women and children. What I observed repeatedly in sessions with parliamentary committees is that what we saw was that risk was routinely and systematically moved out with services onto the shoulders of the least powerful and the most vulnerable. And a really good example of that, I think, would be court closures where courts were, and just prior to the second lockdown, the court service just announced with 24-hour notice that courts were going to be closed. And when we inquired how witnesses who would be in domestic abuse cases would be complainers, and their children perhaps being called to give evidence would be notified about that, the response we got was, we don't have the capacity to do that. We'll tell the judges and the witnesses and the sheriffs and the witnesses for the cases we will hear. And so what we would get would be multiple calls from women saying, I went on a bus at 7 o'clock this morning, and remember about public transport and risk for COVID, on a bus with my children, and we traveled for 2.5 hours to the court and it was closed. What was going on? Or they would be, the risk to staff in the courts was managed by making people queue outside the building. Now, there was one queue, and that included perpetrators, or, accused and complainers and children. Once again, we're seeing the risk being moved from the most powerful in Scotland down to the least powerful and most vulnerable. And so to come back around, the uncertainty about how the systems were going to respond to risk in the context of sexual assault and domestic abuse meant that both our helpline and rape crisis through the Scottish Women's Rights Centre had many calls from women saying, who's going to protect me? Do I have to go to court? Who's going to tell me whether I have to go to court? Can I bring my children? Do I have to bring my children? All of those questions, which were, the usual things that women shouldn't have to be worrying about when they were worrying about actually protecting themselves from a perpetrator.
Can we go on to access to justice? Again, some of this we've already touched upon. And in paragraph 36, for example, you quote from the paper that we looked at earlier. And again, we can take, without any disrespect, that as read. And I think also you make the point in paragraph 37 that the access to legal advice agencies, solicitors and informal, less formal agencies, was reduced or had limited capacity. And that would apply both for the perpetrator of domestic abuse, but also those who wanted to ascertain what their rights would be to avoid that.
It was a terrible situation, to be honest, and it's not recovered. Between lack of, in the best of times, lack of access to legal aid is a big problem for complainants, for women and children experiencing domestic abuse. So for instance, one of our services is in Shetland, and they haven't had a legal aid office in Shetland for 5 years. All of our services reported difficulty in accessing legal advice for women and children across the criminal and civil settings. And one of the issues that came up in the island communities was that even though there were now services, for instance, so solicitors in Glasgow were offering to provide services in, Shetland and Orkney, because it was provided by video link and remotely, they were taking so many cases, first in part because the supply of solicitors had dropped, and women solicitors, which are often overrepresented in family law and public sector law, were affected by the same labor market issues that Kat was describing. But also, the women would be being represented or advised by a solicitor in Glasgow who had no conception of the local situation, or women would be told that we had cases where women were the solicitor was mixing up cases and in court talking about a case that actually was a different case than the one that was being heard, because they were taking so many cases from out with Glasgow. So I think it's really hard to underestimate how harmful the lack of access to legal aid and legal representation and services was, but also the impact on the industry is extraordinary, and we're still struggling. We have staff who make 50 calls before they can find a solicitor.
I think you summarised that in paragraph 39, where you say that the suspension of court proceedings, and I suppose one factors in the difficulties in obtaining legal advice, etc., has had and continues to have a hugely negative effect on those seeking access to justice.
Absolutely. And I just want to say, I've been talking a lot about domestic abuse because it's what I know best, but really significant issues for Rape Crisis Scotland and
Yes.
the survivors that they supported. Court delays were already an issue prior to the pandemic, but it was made significantly worse by COVID. Survivors told our helpline and their staff about how difficult it was waiting months or even sometimes years for their cases to reach court, and they're still dealing with those court backlogs.
Yes, and I think in paragraph 40, you make a specific reference to those women who were engaged in the, as you say, the judicial and administrative processes, but in particular, delays in asylum and immigration decisions, prolonged individual experiences of precarious immigration status, increasing risks around homelessness and destitution. Now, I don't want to take that much further at this stage, because we are going to be looking at asylum seekers and refugees as a distinct topic in this inquiry. So we will be looking at that, but we will be mindful of what you said in that respect. And we will take, if you don't mind, just for sake of brevity at the moment, the two quotations as read. Mm-hmm. We go on at 41 to intersecting equalities, and I think we've already touched on this, and I think, again, that's something we can take as read. So at 42, you look at an overview of concerns regarding Scottish Government decision-making. And again, something we've already briefly touched on, but I'd like to understand this as fully as possible. So could you read on from paragraph 42, or one of you read on from paragraph 42?
Mm-hmm. It is vital that lessons are learned from the COVID-19 pandemic and that systemic improvements are introduced to protect the most vulnerable members of our society. This requires a genuine commitment on the part of those in power to realise the human rights of those most likely to have their rights violated, and to ensure that decision-making includes intersectional gender competence.
Please, can you just continue?
Yeah, sure. The Scottish women's rights organisations recognise the need for rapid decision-making in response to an exceptional event like the pandemic, but the evidence indicates that in working at pace, public bodies often neglected critical safeguards in equitable decision-making, overlooked the primary differences between men and women's lives, entrenching and exacerbating women's inequality in the longer term.
Just picking up one thing you say there is that evidence indicates that working at pace. Was that a real issue, that so many decisions were having to be taken so quickly that other issues, such as those that you identify, were ignored?
I think
one at a time.
Yeah, I think that we would accept, and you know, we would accept that difficult decisions had to be made, and they had to often be made at pace, and they will at times be imperfect as a result of that. But where our concern is that we had been advocating for decades prior to the COVID crisis for better gender mainstreaming in decision-making processes in the UK and in Scotland, and the evidence has been available around this, and very detailed approaches to it have been available from the 90s onwards. And the fact that we didn't have a decent gender mainstreaming approach in Scotland or the UK, and that the work hadn't been done in the decades prior to the COVID crisis, meant that it wasn't baked into the system. That can be done. That is not something, the system does not need to exist the way that it does at the moment, thinking about these things as somewhat of an afterthought. There are ways to make decision-making that absolutely integrates the differences between men and women, and the intersectional differences for certain groups of women or vulnerable individuals. That can be done, and the mechanisms exist to do that. We understand what they are, we know what they are, we know what needs to be done. We've been advocating for it for decades, and it wasn't done to the extent it should have been in the UK and Scotland, and it meant we went into that rapid decision-making process with systems that we knew weren't going to deliver what we needed to deliver in that respect. So I do take on board that when decisions are made quickly, they will be by their very nature imperfect. But the bigger issue is that there could have been better systems in place to make those very quick decisions.
Can I just add one thing to that?
Yes, please.
So an example, in a meeting that I had with senior officials and stakeholders, so, you know, charities, in the children's, children and young people's area, we were talking about decisions around key workers and hub schools and what was happening for the education of children. And it was a meeting in which I was saying much of what I've said here about my concerns about the failure to consistently understand the impact of domestic abuse on children and their mothers, and to incorporate that into who were key workers, how were hub schools run, et cetera, et cetera. And I was asked what would have made a difference. And I said, well, do you have an equality impact assessment for your decisions? And I was told very firmly by a senior official that we didn't have time for that, and I won't apologize. And for me, that's a perfect example of equalities for Christmas. Do you know what I mean? So in other words, we care about equality until it's too hard. And I think that's what underscores what Kat was saying, which is you can't do equality, in 20 minutes at the end of your decision-making. And Scotland, under the specific duties under the public sector equality duty, is very clear in law about the requirements to do equality impact assessments before you make policy. If even prior to the pandemic, if people had been routinely doing decent equality impact assessments, or even doing them at all often at the time that they were supposed to, those decisions would have been so much easier for them. But because they had continued to treat it as an add-on, they didn't have the skills that were necessary for it. It wasn't intentional, but it was harmful, deeply harmful.
So, your experience, was the impression that you got from the dealings that you had with decision makers that the intersectional basis for decision making was not embedded at the outset? It was just brought in as a, well, does it comply once the decision is taken?
I think...
Well, on the basis of what you already said, it was a failure as a matter of law not to have had such a survey. So it's a rather odd situation in that the mechanism, had it been used, was already in place. Mm-hmm. So, yeah, I understand that. It's perfectly clear, but it's an interesting situation. I think possibly you were on the right lines, or perhaps nailed it by saying that if there'd been a different attitude, because if the relevant decision makers or policy makers had complied with existing law, then there might have been a better framework to make decisions at pace.
Absolutely.
Yeah.
And possibly, of course, that could be applied to many other things away from the subject we're discussing this morning. But
indeed.
Yeah. No, I
Do you want
understand.
to talk about it?
So just to reiterate that, I mean, I think that there's the public sector equality duty. These are legal duties on public authorities. There's also, arguably, duties under European Convention on Human Rights around these things, and non-discrimination. So they shouldn't be the cherry on top of the cake. They should be baked into the cake. And we've said throughout this that we know the components of what these should look like. So they are competency, a general level of competency in decision making across the board, not just certain equalities champions that sit and who are often excellent but are vastly outnumbered, and the vast majority of decision makers don't have that basic competency. The other thing that we know is needed is quality data. So data that looks at the different experiences of men and women, data that is gendered. It's not just counting men and women, it's looking at the differences in their experiences, and we can call upon data to try and give us some insight into that, but also data that looks at the specific experiences of, for example, black and minority ethnic women. And there have been, decades of delay in Scotland, in the UK and in other parts of the world where we just are not given enough attention and resources to developing these data systems that will inform the decision making that is required, and that has, a very kind of serious impact. So these are things that are well known. They are part of the legal obligations that should be delivered, and they're not being delivered. And just one final thing is that I think that prior to the COVID pandemic, the public sector equality duty is imperfect. It is something, and we've got it, and it's a legal obligation. It's not everything we would want it to be. And to their great credit, Scottish Government have recognised that. There was a review of the public sector equality duty due before the COVID pandemic. It was delayed. It has been picked up again now, but we're being told that it will probably be less than we had hoped for in terms of reviewing and enhancing the public sector equality duty and its provisions. And also in between times, for example, the team within Scottish Government that were working on it were seconded to work on the Ukraine crisis. Now, I'm not saying that there's anything wrong with that per se, but we do have a suspicion that equality is always one of these equality provisions are always within government in the UK or Scotland. They're always something that will be dealt with after we've got to this stuff. And that's what got us to the point in the COVID pandemic where decisions were made at pace, the competency wasn't there, the data wasn't there, the mainstreaming wasn't there, and the failures to deliver on legal obligations were a reality, unfortunately.
Sorry, can I just, following on that, and this is perhaps a rather unfair question because I don't think it's necessarily been prefaced in material that you've looked at or been asked. We do know, and we are investigating, that there was a degree of pre-pandemic planning in Scotland for a type of pandemic. I think it was essentially an influenza-based preparation, but that was what was being looked at. Were any of your groups or any of the women's rights groups involved in that pre-pandemic planning?
That's such a good question, because it comes...
I'm glad it is, because I was rather concerned it might not be.
It comes back around, no, the answer is to that. And it comes back around to when we talk about women's lack of access to power and resources, it's about, being at the table when decisions are made, when problems are identified, when solutions are identified, and when resources are allocated to deal with that. And the absolute lack of inclusion of gender experts and in things like planning for pandemics means that you're reverse engineering so much when it actually happens. And I think that that's a really good, and that is repeated over and over. And I do just want to say that there were some wonderful exceptions in all of this. I think that the Equality Unit, which was and is continually deeply under-resourced, was working really hard with the few people that were left to help gender what was happening in other aspects of government. And I would say in the terms of the violence against women team and the minister at the time, Christina McKelvey, we found an extraordinarily deep understanding and a really rapid response from that element of government. But and I will say, in my discussions with my counterparts in England, Wales, and Northern Ireland, it was like night and day, and we were offered immediate funding to help us deal with the pandemic, and they were, at best, many months later, still having to argue about that. So I think it's really important that we not point out that the government has the capacity, and the courts and the police and everybody has the capacity to do this well. But if they don't resource it and they don't hold people accountable for the law, for applying the law, then as we've said, they'll have learned nothing from this pandemic.
Thank you. To a certain extent, we can take some parts of this as read because we have already dealt with it. Could we go to paragraph 46, please, which I think is really a bit of a summary of some of the matters that you've been raising. Perhaps you would just read from paragraph 46 onwards.
Did you want me?
Yeah, sure.
Yeah. Existing systems and processes within the Scottish Government were insufficient to mainstream gender and equalities considerations into crisis management, ongoing strategy and policy responses, crisis funding, program development, service design, and recovery plans. This failing entrenched the unequal impacts that were affecting women and marginalized groups across Scotland.
Continue on, please.
Mainstreaming equality is a requirement of the Scottish specific duties under the public sector equality duty. The failure to use the tools available, such as equality impact assessments, which are a legal requirement, resulted in a lack of understanding on the impact of crisis management proposals. This inevitably led to unintended negative consequences for already marginalized people, failed to prevent harm, and wasted time and resources by having to mitigate or change approaches during the pandemic. Disadvantage was exacerbated instead of ameliorated, which increased disproportionate harm and tragedy in certain families and communities.
I'd like you just to read to the end of
Keep going, huh?
that section, so if you could keep going. Thank you.
The government had an obligation to monitor the impact of measures taken to address the pandemic for any disproportionate negative impacts on particular groups that could constitute discrimination. However, monitoring data was inadequate and should have been disaggregated by gender and other relevant factors such as ethnicity, age, disability, and socioeconomic status to enable assessment of the impact on groups potentially suffering from intersectional discrimination, such as women from ethnic minority backgrounds, disabled women, older women, or women living in remote and rural areas. There was also a failure of policymakers to take a step back and look across all policy areas to evaluate how the policy decisions taken during the pandemic cumulatively contributed to the enormous harm that women and children were experiencing, especially as a result of domestic abuse. For example, the Scottish Government and Equally Safe strategy cite gender inequality as the cause and consequence of domestic abuse and consistently reiterate that domestic abuse is a critical priority. However, government messaging, especially early in the pandemic, to stay safe at home without caveats that movement restrictions did not apply to those dealing with domestic abuse caused significant concern. There then came a misleading narrative from government messaging and media reporting that COVID-19 and lockdown were causing domestic abuse in Scotland. Lockdown created a situation favorable to abusers and presented considerable obstacles for women seeking to access services. However, lockdown did not cause domestic abuse. This problematic messaging was apparent in the initial daily COVID-19 updates, although following advice from organizations like the Scottish Women's Rights Organization, this messaging changed. However, it remained a recurrent narrative in Scottish government media accounts and reporting from Police Scotland. Still? Keep going?
Yes, please.
The disproportionate and damaging impact on women could have been mitigated to a greater extent if intersecting gendered inequalities had been mainstreamed as a core concern of the Scottish Government's decision-making processes. The key problems were a lack of gender competence within the Scottish Government, a lack of prioritization around women's equality by senior officials, inadequate data use, especially intersectional, gender-sensitive, sex-disaggregated data, a lack of attention given to gendered impacts in guidance and advice developed for employers, a failure to mainstream gender equality, which is a legal requirement under the Scottish specific duties.
And just go back to paragraph 50 and the messaging that is referred to there. You highlight the problem with the initial message that was being put out, and then you indicated that you gave certain advice and the messaging changed. Was it possible that the messaging just became embedded before the change, and it was somewhat difficult to counter what was the initial impression of the messaging?
Undoubtedly, absolutely. So if you ask people today, they would still say that COVID caused more domestic abuse in Scotland. Just like they used to say it's the drink or old firm games or, you know, a real misunderstanding of the dynamics of domestic abuse. And if you recall, we had daily updates from the Scottish Government, often the First Minister. And I'm happy to say that officials in those updates began to adjust the messaging. So when they talked about taking protective measures and including, you know, staying at home, they became, unless, of course, you're experiencing domestic abuse or other forms. But the damage was done, as I think you've pointed out. And then the reality is that that messaging was not certainly consistent across multiple public sector institutions. So the damage while ameliorated, and it could have so been avoided, as we've said, if people had just for 1 minute thought about how the lockdown restrictions were going to be affecting different people differently.
In your conclusion, you indicate it's rather a useful conclusion because it tells you what you said at the beginning, which is that you feel somewhat constrained by the brevity of the statement. As I said, we will undoubtedly ask you to give further evidence to the inquiry and information to the inquiry. You set out at the end the various documents that you have provided to the inquiry, and as I've said, all of those documents are now with the inquiry. They will be considered in detail and analysed and will input into our eventual recommendations and report. But subject to that, Dr. Scott, Ms. Murphy, who I think wants to say something else.
Is it okay if I just make 2 quick points?
Yes, please.
Yeah, so just an overarching one that possibly we should have made at the start. I think that within the pandemic, and it's not unique to Scotland, but it certainly played out in Scotland as it did in many other countries, was this kind of assumption that because this is an urgent public health crisis, kind of all bets are off to a certain degree with equality requirements and human rights requirements. And I think legally that is not the reality, and it will be obviously for this inquiry to interrogate that. But I think there was some things that were also done that sent a message very much that this is not as important as this public health crisis. So, for example, when the reporting for the public sector equality duty was cancelled in 2020, that sent a very strong message that equality isn't as important. And what we would very much argue is that equality and human rights becomes even more important within a public health crisis. It's not something that sits at the side of a public health crisis, and I think that's something that we would really want to leave with you for that. And I know it's an overarching issue. The other thing, and just one quick thing, is that around gender mainstreaming within Scottish Government have, and there has been quite significant leadership right from the top within Scottish Government to try and make change. So the Equality Unit has been expanded into an Equality and Human Rights Directorate, and I just want to acknowledge that. And there's also been a National Advisory Council for Women and Girls that was instituted by the former First Minister, which has been very welcome. But one thing I would just finish up with is that, I don't know if you're familiar with the phrase that culture eats strategy for breakfast. And I would say that I would include in that is culture and resources eat strategy for breakfast. And one of the things that are lack thereof, one of the things that even though we've had some degrees of leadership, there has been consistent lack of resources and addressing a culture that can sometimes play out as obstruction. And I think that Marsha's example of kind of like, well, EQI is not needed here and we're not going to apologise for it, that's culture as much as it is anything else. So I would just say as well that within that, it's not just about commitments at leadership level, it's making sure the culture follows suit and that there are resources behind it to deliver.
Thank you very much to both of you.
Yes, thank you both.
You're welcome.
Right. At 2 o'clock?
Well, yes. I don't know, is it possible to, just to make some more time for us, to be perfectly frank, we could start earlier. We've got an hour and a half.
The witness is giving evidence remotely.
Ah, right.
So I think the arrangements may be in place. We can see.
Yeah, I appreciate that. It might be possible. It's just simply that...
Make some... Yes,
yeah, it's...
appreciate that.
Yeah, good. Thank you.